Start, Dr. Zainab. Start.
Hi guys, good evening. I hope we are visible and audible to you all, both of us. Just give a quick confirmation in the live chat if the audio visual is good. Um, welcome to this integrated anatomy radiology session that we are having with Pradeep sir and myself. I'm Dr. Zainab Vora, and we are going to be discussing cranial foramina, which we feel is very important for your exams, and you get a lot of image-based questions from this. A quick confirmation if we are both visible and audible to you all, and if we can start.
Good evening. Good evening to all of you.
All right, I think it's good. All right, sir. I will just share my screen. Is the screen visible, sir?
Yeah. It's visible.
Okay. So you guys know about the Plus subscription where you get unlimited access to all the educators on the platform, and printed notes are also coming up very soon for the students, and you can combine it with Iconic subscription where you also get a prep ladder along with Unacademy. And this is the grand test schedule which is ongoing for all the students. It's free of cost for all of you guys to attempt, and we also have a scholarship test which is coming up on 14th of August where you will get plus subscription for free. So definitely do give this an attempt, and this is also something which is quite important for your exams. All right, so this is a good idea to practice, and all of these are the batch courses which are going on the platform which you can access. So now jumping right on to the cranial foramina. I think sir can start with the anatomy section, and then the plan is to look at some radiological CT images of these foramina. Sir, please take the lead.
So good evening to all of you. Thank you, Dr. Zainab.
Yes.
So let us start with this foramen. Okay, the picture quality is fine, no?
Yes, I mean it's fine. So what you can do is anybody who's facing problems with the resolution, just go to the quality section of your YouTube and just change it to high quality and highest resolution, and that should help. That usually makes it better. Yes, sir. I think it's
Okay,
all.
fine. Okay, so welcome all. Let us start with this cranial foramen. Now, let us start with this cranial fossae. We have got three cranial fossae: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. Anterior, middle, and posterior cranial fossa. So now we have got this lesser wing of sphenoid. Lesser wing of sphenoid. Yes, we've got this lesser wing of sphenoid. So from the front till the lesser wing of sphenoid, that's the anterior cranial fossa. From the lesser wing of sphenoid to the petrous part of the temporal bone. Thank you, Dr. Zainab. To the petrous part of the temporal bone, this is the middle cranial fossa. And behind the petrous part of the temporal bone, we all know that's the posterior cranial fossa. Posterior cranial fossa. Okay, so now let us start with the anterior cranial fossa. Anterior cranial fossa. I'm not visible.
You're visible, sir. Yeah, you're visible, I think.
I'm visible. Okay, fine, students. So let us start with the anterior cranial fossa. You can see this bone here. That is the orbital plate of frontal bone on either sides. Orbital plate of frontal bone. Dr. Zena, please point it out.
Yes, sir.
Orbital plate of frontal bone. Then we've got this cribriform plate of ethmoid. Cribriform plate of ethmoid. Yes. And we've got this frontal crest. Frontal crest. The frontal crest. Just where the frontal crest meets the cribriform plate, we've got a foramen there, and that's the foramen cecum. Foramen cecum. Okay, this cribriform plate of ethmoid shows multiple perforations. You can see those perforations, and what passes through these perforations is the olfactory nerves. Olfactory nerves, right? Olfactory nerves. That's fine. I'll just tell. Don't write. That's olfactory nerves. You can see the optic canal there. Optic canal. Please point it out. Optic canal. Yeah, that's the optic canal. Yes, students, what passes through the optic canal? Now we've been. Can this be zoomed, Dr. Sana? Can we zoom this?
Yes, sir. I'll have to exit the slideshow for that.
Let us zoom it because students will not be able to see. Okay, fine, fine. Just one moment. We are
Is it
okay.
better now?
Yeah, this is nice. This is nice. Yeah. So, students, what we are discussing is the. It's gone. Okay, fine. This is good. Yes. Okay. So the frontal crest. Just mark that, Dr. Sana.
Yeah.
Frontal crest. Okay, that's a frontal crest. You see the cribriform plate of ethmoid bone, which is perforated. A perforated plate, that's a cribriform plate of ethmoid. And what comes in through the cribriform plate of ethmoid are the olfactory nerves. Olfactory nerves. Now, optic canal, the second foramen in the anterior cranial fossa, that's the optic canal. Optic canal, yes, students, we've been discussing this in all my sessions. Optic canal, what passes is the optic nerve and the ophthalmic artery. Ophthalmic artery. The optic nerve and the ophthalmic artery passes from here. Right. Then the lesser wing of sphenoid. Lesser wing of sphenoid. Yes, and just below the lesser wing of sphenoid, there's a long fissure, and this is what we call as the superior orbital fissure. The superior orbital fissure, and what passes through the superior orbital fissure?
So
The
there
third.
seems to be, sorry to disturb you, there
Ah, ah,
seems
ah,
to be some, if I mute, if is it better if I mute, I'll just,
yeah, okay, yeah, fine. So that's the superior orbital fissure, and what passes to the superior orbital fissure is the third, fourth, sixth nerve. Yes, and the ophthalmic division, which further divides into lacrimal, frontal, and nasociliary nerve. Nasociliary nerves. Okay, 3, 4, 6, and the ophthalmic division, which divides into lacrimal, frontal, and nasociliary nerves, along with the superior and inferior ophthalmic vein. Okay, the superior and inferior ophthalmic vein, and the recurrent meningeal branch of the ophthalmic artery. Recurrent meningeal branch of ophthalmic artery. Then you can see the anterior clinoid process there. The anterior clinoid process, right? So these are the things that we are going to get in the anterior cranial fossa. Over to you, Dr. Zainab, for the radiological features. Unmute, unmute, unmute.
yes, yes. Now, if we look at the CT anatomy, all right, so we are basically on a coronal CT image. So, how do we recognize this? So, first of all, the bones appear white, right? So, this is a coronal CT that we are looking at the anterior skull base. So, I've taken a section anteriorly. All right, is it fine now? My voice is audible, right? So, the bony plate that we can see here, which is marked by the violet arrow. What is that? Can anybody tell me what is the violet arrow which is marking this anteriorly? Yeah, so this is the Crista Galli. So this is CG, which stands for Crista Galli. Now there is this plate here that we were seeing, which had all of these cribriform or these apertures, tiny apertures, hence the name cribriform. So this plate here, through where we have the nerves which are passing on, ophthalmic nerve roots which are passing, the one marked with yellow, this is the cribriform plate. All right, and when I go more laterally, cribriform plate forms the base. So if this is the crista galli, these are the two cribriform plates. Now when I go more laterally, what is this green arrow showing? What is this? This is the lateral lamella, isn't it? This is the lateral lamella. And finally, when we go to the roof of the ethmoid here, this part marked by the red arrow, what is that? That is called as fovea ethmoidalis. All right, so fovea ethmoidalis is this horizontal plate. So now one question to you from anatomy, applied anatomy here. If I want to measure the depth of the cribriform plate, what is this classification called, and why is this so important to see how deep the cribriform plate is? It is called the Kiros classification, isn't it? So this is the Kiros classification where we take the height from the fovea ethmoidalis to this cribriform plate. So somewhere from this area to this area, I measure the depth, and this is very important. The deeper the cribriform fossa lies, the worse it is for FES. All right, so this is very important for injury to anterior skull base when the surgeons are performing the face operation. So you need to know the applied anatomy of this part of the anterior skull base. So this was about cribriform plate, our first plate. Is this section clear to everybody? Crista galli, cribriform plate, lateral lamella, and fovea ethmoidalis. So these are the four big words that we want to remember here. Now going on to the optic canal and superior orbital fissure. So like sir explained, this is the lesser wing of sphenoid here, right? And this projection here is the anterior clinoid process. So now what is this foramina, which is bound by the lesser wing of sphenoid alone? What is this rounded foramen here? This is the optic canal, isn't it? So can I say optic canal is more medial? Yes. And the one which is more laterally placed, the longer one, the fissure-like thing, which is between lesser wing of sphenoid and greater sphenoidal wing. What is this? This is the superior orbital fissure. And this bony projection in between the two is called what? What does OS stand for? This is the optic strut. So what should I look out for when I'm going to look at the CT image? Do you agree that I want to look at a bony projection called the optic strut, and any opening which is medial to it is going to be what? This bony opening medial to it, or this opening medial to it is going to be optic canal. So this is the optic canal through which, can you see this optic nerve which is passing? So this right here, medially, optic canal, and the one opening which is lateral to it, near the lesser wing of sphenoid. Lesser wing of sphenoid. What is this lateral opening? This is the superior orbital fissure. Is this clear? Everybody on the CT, just an application of this. So we look out for a bone, which is the anterior clinoid process, and the optic strut. उसके जो medial है, ये है optic canal. उसके जो lateral है, ये है superior orbital fissure. Okay, and contents, sir has already told us. So just to recapitulate and confirm, when we talk about the anterior skull base, foramen caecum, like sir has already told us, cribriform plate, optic canal, only lesser wing of sphenoid, superior orbital fissure, between lesser and greater wing of sphenoid, more lateral. Are these four foramina clear? So we can go back to sir and we can look at the middle skull base now. Yes, sir?
Yeah, you're fine. Can we?
Yes, sir. I'm just going back to the same image. Yes, sir.
Yeah. Can you zoom it? Is it possible?
Yes.
Okay. Nice, nice. Yeah. Okay. So students, the middle cranial fossa. What is the extent of the middle cranial fossa? It extends from the lesser wing of sphenoid, to, just point it out, please. It extends from the lesser wing of sphenoid to the pitris part of the temporal bone. The lesser wing of sphenoid to the pitris part of the temporal bone, right? So that's the middle cranial fossa. And in the center of the middle cranial fossa, we can see the depression there, which we call it as the sella turcica. Sella turcica, who lies there? The pituitary gland. Pituitary gland. And right on either sides of the pituitary gland, there's something which lies on either sides of the pituitary gland. Yes, students, come on, answer. There's something which lies on either sides of the sella turcica, the pituitary gland. What is that? It forms the medial relation of that particular thing which I'm asking you. What is that? What is that structure on either sides of sella turcica? Yes, very good. That's a cavernous sinus. So that's a cavernous sinus. We all know the cavernous sinus lies in the middle cranial fossa, extending from the lesser wing till the pitris part of the temporal bone. Now, all the major foramen that we get in this middle cranial fossa, which is formed by the greater wing of sphenoid bone, the greater wing of sphenoid. Right. Now, the first foramen that we normally talk about is the foramen rotentum. Foramen rotentum. Yes. Students, what passes through the foramen rotundum? Anyone? Foramen rotundum? I always discuss this foramens in the lectures, all the lectures that I take. Foramen rotundum, what passes? There's a nerve. It's a branch of trigeminal nerve. It's a branch of trigeminal. The nerve passes through the foramen rotundum. What is that? That's the maxillary division of trigeminal nerve, right? Maxillary division. enters into the foramen rotundum, then enters into the pterygopalatine fossa, and then gets straight out from the pterygopalatine fossa, emerges below the orbit, and this is what we now call as, yes, students, what is that nerve now known as? The maxillary division of trigeminal nerve now continues as hmm, the infraorbital nerve. Infraorbital nerve. So what passes through this foramen rotundum is the maxillary division of the trigeminal nerve. Then it enters into the pterygopalatine fossa and then straight emerges below the orbit as the infraorbital nerve. Okay, so that's the foramen rotundum. The foramen, yes, very good to all of you. The foramen, next to the foramen rotundum, we find a comparatively larger foramen. What is that? That's the foramen ovale. And this you all know, foramen ovale, you always have a mnemonic for that, foramen ovale. What is that? That's MALE, which normally the students say. Yes, what is that? The mandibular nerve, the accessory meningeal artery, yes, the lesser petrosal nerve and the emissary vein. Emissary vein. The mandibular nerve leaves the skull through the foramen ovale, and the moment it gets out through the foramen ovale, it's right into the infratemporal fossa. Infratemporal fossa. The accessory meningeal artery. The accessory meningeal artery, it's a branch of, come on, students. Accessory meningeal artery, a branch of, anyone? Accessory meningeal artery, it's a branch of maxillary artery. The first part of maxillary artery enters the skull through the foramen ovale. The lesser petrosal nerve, we all know, this is a branch of glossopharyngeal nerve going to supply the parotid gland. And the last one is the emissary vein. Emissary vein. This is fine, no? Dr. Zainab? Students, are you able to follow this? This is just a quick revision that, I'm going through. Fine, so that's about the foramen ovale. Now, behind the foramen ovale, yes, you can see a small foramen there behind the foramen ovale. Yes, what is that foramen? Students, what is this foramen? Behind the foramen ovale, that's the foramen spinosum. Foramen spinosum. And what enters the skull through this foramen spinosum? This I always tell you that the nerve, when it lies in the cranial fossa, it has to supply the meninges of that cranial fossa. Like if a nerve is lying in the anterior, it should supply the meninges of anterior cranial fossa. If a nerve is lying in the middle cranial fossa, yes, it should supply the meninges of middle cranial fossa. So ideally, mandibular nerve lies in the middle cranial fossa. It should have supplied the meninges of the middle cranial fossa. And this it should have done when it is inside the skull. But we don't know what happens. Somehow the mandibular nerve does not supply, it forgets to supply the meninges. And when it gets out of the skull through the foramen ovale, when it is right in the infratemporal fossa, it suddenly realizes that it had to supply the meninges, sends a branch, and this branch enters the skull through the foramen spinosum. And this is, it goes in the reverse direction. It is known as the recurrent branch of mandibular nerve, or it goes to supply the meninges. Therefore, it is also known as the meningeal branch of mandibular nerve, passes through the foramen spinosum, therefore known as nervus spinosus. So three names for the same nerve. It is nervus spinosus, or the recurrent branch, or the meningeal branch of mandibular nerve. And the artery which comes with it is the middle meningeal artery, which is a branch of the first part of maxillary artery. Okay, so foramen spinosum, what passes is nervus spinosus and the middle meningeal artery. I hope this is clear to all of you. And the foramen, which is just at the apex of the petrous part of temporal bone. Yes, students, what is that foramen? Just at the apex of the petrous part, that's the foramen lacerum. Foramen lacerum. And what enters the skull through the foramen lacerum? Yes, that's the internal carotid artery. The internal carotid artery at the skull base enters into the carotid canal, and inside the skull, it enters through the foramen lacerum. Foramen lacerum. Clear? So these are the foramens in the middle cranial fossa. Yes, please, Dr. Zainab.
Yes, sir. So now let's look at the respective CT anatomy. All right. So we've done the anterior skull base. Now let's go into the middle cranial fossa, like sir has just elaborated for us. So here, one thing to remember: the mnemonic ROS. Right. That is how we remember rotundum, ovale, spinosum from anterior to posterior. Now the trick here, or the caveat here is that foramen rotundum is slightly inferior. So when I look at an axial CT section, like we are looking here, I will not see rotundum at the same level as ovale and spinosum. So this is something which you have to remember. So what do you look out for when you see two paired foramina? One is oval in shape, one is very tiny in shape, right? So what are these two? These are ovale and spinosum. So remember, rotundum will not be in the same level. All right, so this is foramen ovale for us here, and this is spinosum. Again, just to orient you, what are we seeing here? This is the sphenoidal greater wing of sphenoid that you are seeing, and this bone right here is the clivus, right? So this bone is called the clivus bone that we'll discuss when we go to posterior skull base. So remember, ovale, spinosum, we already know the content. So they can ask you an applied anatomy question on what are the structures which pass through this, and this is the highest likelihood question, all right, where you will be marked ovale and they'll ask you the structures passing through it. So that becomes a radiological anatomical correlation as well. Okay, now let's have a look at a coronal image. All right, so now we are at a coronal image, and let's do some again some integration. All right, so we look at anterior skull base also and middle skull base also. So before we go to that, what is this bone here which has a medial plate, which has a lateral plate, which has a body? What is this bone? This is the pterygoid, isn't it? So these are the medial and lateral pterygoid plates, and this is the body. Now in the body of the pterygoid, we are having these two foramina. Very, very important. So one foramina upper, one foramina niche. So the one foramina which is upper. All right. So remember, rotundum upper. All right. So that is how you can remember. And niche we have the Vidian canal. So foramen rotundum, Vidian canal. These are the two foramina which are within the pterygoid, and that also explains why the content of foramen rotundum, which was what? Which was the maxillary arteries opening straight into the pterygopalatine fissure, right? And it is opening anteriorly. Something very interesting to note when we are looking at this image. Did you guys realize something? That all of the other foramina that we have studied in the medial skull base, just looking for the eraser, are all having air. Do you see this white air in it? But the rotundum does not show that, right? Rotundum, the fissure do not show that. Why? Because it opens anteriorly. It is not opening supero-inferiorly, but it opens up anteriorly. All right, so that is why, again, remember something, foramen rotundum, maxillary nerve goes anteriorly into the pterygopalatine fissure, and it is an opening in the pterygoid plates. Similarly, just to again revise the medial lateral relationship, this is the optic strut that we are having. So when I ask you what is this canal medially, what is this? This is optic canal, and the one fissure here laterally, what is this? This is superior orbital fissure. So in one plane, when I take a section, I see four foramina. All right, so this is again something which can be tested, slightly more difficult. Optic canal, superior orbital fissure, medial lateral, we can make it out. Supero-inferiorly, foramen rotundum versus the Vidian canal. All right, so this is something that we are having on the CT coronal. Just to revise again, superiorly in relation to the sphenoid sinus here, what are we having? Foramen rotundum. Inferiorly, we are having, inferomedially, we are having the Vidian canal. This is the pterygoid plate, medial pterygoid plate, lateral pterygoid plate. All right, so this is the anatomy as far as the middle cranial fossa is concerned, and then we come back to the posterior skull base. Yes, sir.
Yeah. Okay. So coming to the posterior cranial fossa, right? Extends from the petrous part of the temporal bone to the occipital bone behind, right? So petrous part on either sides to the occipital bone behind. Right. Okay, so now you tell me, who lies in this petrous part of the temporal bone? In the petrous part lies the middle ear and the internal ear, the middle ear and the internal ear. And if any structure has to enter the skull, enter the ear from inside the skull, There's a foramen right in the petrous part of temporal bone. The foramen, yes, and this is the, yes, that's the foramen there, and this is the internal acoustic meatus. Internal acoustic meatus. Come on, students, what passes through this internal acoustic meatus? Answer this. It's just a quick revision for you. Internal acoustic meatus, what passes? Two nerves. One is the seventh nerve, the eighth nerve, and the artery going to supply the labyrinth. That's the labyrinthine artery. The seventh nerve, the eighth nerve, and the labyrinthine artery. That lies, that internal acoustic meatus, which lies in the petrous part of the temporal bone. Clear? The seventh nerve, the eighth nerve, and the labyrinthine artery. Just in line with the petrous part, just in line with the internal acoustic meatus, we get a large foramen here. What is that? The large foramen, that's the jugular foramen. Jugular foramen in the same line of the internal acoustic meatus, a large foramen there, that's the jugular foramen. And students, as we all know, this jugular foramen is divided into three compartments, right? Anterior, middle, and posterior. And what passes to the anterior compartment? Yes, anyone answer this. What passes to the anterior compartment? There's a sinus which lies on the inferior border of the petrous part of temporal bone. Yes, that's the inferior petrosal sinus. And this inferior petrosal sinus gets out through the anterior compartment of the jugular foramen, gets outside the skull, and it now joins the internal jugular vein. Right? So the first tributary of the internal jugular vein is going to be the inferior petrosal sinus. Clear? So anterior compartment of jugular foramen, what passes? Inferior petrosal sinus. Through the middle compartment, there are three nerves which exit: the ninth, the 10th, and the 11th nerve. The 9th, 10th, and 11th, they get out to the middle compartment of the jugular foramen. And who gets out through the posterior compartment? Right, there's a sinus in the occipital bone. What's that? Can you please point out, Dr. Zainab? You can see that sinus in the occipit, in the occipital bone. Yes, that's a transverse sinus. The transverse then becomes an S-shaped sinus. What is that S known as? The sigmoid sinus. And this sigmoid sinus leaves the skull through the posterior compartment of the jugular foramen. Once it's outside the skull, it is now known as the internal jugular vein. Internal jugular vein. So just once again to brief, what passes to the jugular foramen, anterior compartment is the inferior petrosal sinus. The middle compartment, the 9th, 10th, and the 11th cranial nerves, and the posterior compartment is the sigmoid sinus, right? Now, just in line with the internal acoustic meatus, the jugular foramen, now you get a small foramen on either sides of the foramen magnum, and this is the hypoglossal canal, or it is also known as the anterior condylar canal. Anterior condylar canal, what passes to this is the hypoglossal nerve. Okay, anterior condylar canal or the hypoglossal canal. The hypoglossal nerve passes through it, and you can see a slope there, in the center. This slope is known as the clivus. What madam was telling you, that slope is known as the clivus, and who lies on this clivus is the brainstem. The brainstem lies on this clivus, and all the cranial nerves begins from the brainstem except the first and the second. So which cranial nerves are present in the posterior cranial fossa? It's 3 to 12, except 1 and 2. So all the nerves arise from the brainstem, and the brainstem itself is lying in the posterior cranial fossa on the clivus, as a result of which all the cranial nerves would begin from the posterior cranial fossa. That's 3 to 12, okay? And the large foramen there, that's the foramen magnum. Yes, foramen magnum is divided into two compartments by, yes, what is that? Anyone? What is that ligament which divides the foramen magnum into an anterior compartment and a posterior compartment? That's the alar ligament of Dens. Alar ligament of Dens divides the foramen magnum into an anterior and a posterior compartment. Now, what passes to the anterior compartment? Only bones and ligaments pass. So this is what we call as the osteoligamentous compartment. Osteoligamentous, the bones and the ligaments. So osseous is bones and ligaments. So osteoligamentous compartment. Yes, and what passes to the anterior compartment is the tip of the dens. Then the ligament which begins from the tip of the dens, and it is attached to the clivus. It is attached to the clivus. Yes, anyone? What is that known as? Begins from the tip of the dens and it's attached to the clivus. This is the apical ligament of dens. Students, this apical ligament of dens is a remnant of, anyone? Apical ligament of dens is a remnant of. Yes, answer this. Apical ligament of dens is a remnant of. Bolo, bolo, bacho. Notochord, notochord, notochord. It's a remnant of notochord. The second remnant is nucleus pulposus. Nucleus pulposus and the apical ligament of dens. And the third ligament, which is placed in the form of an X, cruciate ligament. Cruciate, right? Yes, very good. So what passes to the anterior compartment is the tip of the dens, the apical ligament of dens, and the cruciate ligaments. Clear to all of you, bacho? And what passes to the posterior compartment is the nerves and the vessels. So yes, it is rightly known as the neurovascular compartment. Neurovascular compartment. So what passes to this compartment is the lower part of the medulla and the meninges. Remember, not the spinal cord. A very common mistake made by the student. What passes to the posterior compartment is not spinal cord. It's the lower part of the medulla and the meninges. There's a nerve which is going up through this foramen, a nerve which begins from the upper cervical segments of the spinal cord and it goes up. Yes, what's this? That's the spinal accessory nerve. The spinal accessory nerve enters the skull to join its counterpart. That's a cranial accessory, right? So one is the lower part of the medulla and the meninges, the spinal accessory nerve. There are arteries which are going up to supply the brain. Yes, the vertebral arteries and the veins. The vertebral arteries and the branches of this vertebral arteries will be coming out of the foramen magnum. What's that? Yes, the anterior spinal artery and the posterior spinal artery. They emerge out from the foramen magnum and the tonsils of the cerebellum. Tonsils of the cerebellum. So just to recapitulate, yes, what passes to the posterior compartment is the lower part of the medulla and the meninges, the spinal accessory nerve, the vertebral artery, its branches, the anterior spinal and the posterior spinal arteries, and the tonsils of the cerebellum. Fine, students. Okay, so that's about the posterior cranial fossa, and you've got that sinus there, the transverse sinus, which then becomes the sigmoid sinus. Everything is clear. Fine, Dr. Zainab, please.
Yes. So now going on to the CT images of the posterior cranial fossa, let's begin with the internal auditory meatus. All right, so the internal acoustic or the internal auditory meatus on the CT is something which looks like this. All right, so before we look at the internal auditory canal, let's have a look here at the more lateral aspect. All right, so on an axial section in a zoomed in image, what are we seeing? This is the petrous apex, isn't it? It's the petrous bone, it's the petrous apex that we were looking at on the schematic. So now just orient yourself that we are at that level, all right, at the petrous apex. And what are we seeing on the lateral aspect? So do you recognize the pinna here? So this is the pinna that you're seeing. So this is lateral, this is medial. All right, so on the lateral aspect, first of all, in the posterior lateral aspect, what are these air cells? These are the mastoid air cells, isn't it? You have mastoid air cells. And what is this air filled cavity where you can see this remnant of an ice cream cone? These are the ear ossicles. So this is the incus and the malleus, malleolo-incudal joint, which forms this ice cream cone within the middle ear, which is again filled with air. And along with that, do you also see a nerve passing here? This is actually the facial nerve. All right, so this is the facial nerve which courses the middle ear. So you can see that facial nerve is going through the posterior wall of the middle ear here. Going further medially, this is the opening through which it enters. All right, so this is the internal auditory meatus or the internal auditory canal, through where we have the 7th, 8th cranial nerve plus the labyrinthine artery which enter. All right, so on the MRI, we can very, very beautifully see these nerves entering. All right, so ye to CT hai, we only see the foramen. On the MR, we can actually see the structures. So when we look at this MR here, it's a T2 weighted MR, isn't it? The fluid here is white. We know it's a T2 weighted MR. So What is this? This part here is the pons. This is the fourth ventricle posterior to the pons, and these are the two cerebellar hemispheres. So can I say that this angle which I am seeing here is what angle? This angle is called the cerebellopontine angle, isn't it? Between the cerebellum and the pons, this is the cerebellopontine angle, and through the CP angle, we have these two nerves which are entering. These two nerves which are entering into this very, very narrow internal auditory meatus. All right. So here you basically have the four nerves which enter in this location that we can remember as 7 up, coke down, that you all know. So you will have 7 up, which means the seventh cranial nerve. You will have the superior vestibular nerve. You will have the cochlear nerve, and down for inferior vestibular nerve. So within the internal auditory meatus, if you take a cross section superior to inferior, this is the arrangement 7 up, coke down, that we will see. So this is about internal auditory meatus. So everybody feeling confident that you can mark out this structure if asked कि एग्जाम में ये structure क्या है? Internal auditory canal. All right. So now going on to the jugular foramen. So again, what bone is this? I want all of you to answer what is this bone that we've talked about, where you have the brain stem which is lying. This is the clivus, isn't it? So ये है clivus, and behind the clivus, what do you see? You notice this large foramina here, which is a jugular foramen, and between the jugular foramen, you have this spine. You have this bony process, jugular spine, which divides it into the anterior and posterior compartments, like sir told us. So the anterior compartment is pars nervosa, and the posterior one is the pars vascularis. All right, so we've already done the structures, wherein in the pars nervosa you basically have the ninth cranial nerve, and then you have the 10th and 11th which are passing behind in the vascularis with the inferior petrosal sinus. All right, so these are basically the jugular foramina, and this is where you have the transverse sinus which is running. All right, so in the CT, just like the schematic, this is where you have the transverse sinus which is running and which continues inferiorly as the sigmoid sinus down here. All right, so this is what we have in jugular foramen. Just anterior to jugular foramen, this is the carotid canal. All right, where you have the ICA which passes. So ICA, posteriorly we have the jugular foramen divided by the jugular spine. Okay, going ahead into the last structure. So again, a coronal image. This is something which I feel can be asked, and every time you see this image, I want you to remember an eagle's mouth or an eagle's face. Okay, so this is an eagle which is forming here. This is a coronal image through the vertebra. What is this bone here? First of all, what is this bone that you are seeing? This is the C2, wherein this bony projection is the dens, and this is the atlas that we have. So this is the C1 lateral masses that you can see. All right, so these are the lateral masses of C1, and what do you see above it? You see the occiput. Okay, so this is the occipital condyle, and here you have the lateral masses of the atlas here. All right, so this is atlas, occipital condyle, and this is the atlanto-occipital joint. Now look at the eagle's mouth here in the occipital condyle. So this particular canal which is within the occipital condyle is the hypoglossal canal, and here you have the atlanto-occipital joint. So one more time, just let's quickly revise this particular section because it is very, very important. So inferiorly, first locate the dens. Just beside the dens with the C2, we have the C1 vertebra, we have the atlas vertebra. Superiorly, we have the occiput forming the occipito-atlantal joint, and here when you have this tubercle, just below the tubercle, this is the hypoglossal canal which forms this beak-like projection. All right, is this clear to everybody? So this is the hypoglossal canal. So if they ask you to mark out where is the hypoglossal canal, it's right here in the mouth of the occipital condyle, which is the lateral most aspect from where we have the hypoglossal nerve which is coursing. All right, so this is about the anatomy here. And just to quickly revise, all right, this is something that we've already done. So if we go back to this particular image and just put a checklist to everything that we have learned. So this is the foramen cecum anteriorly. We have the cribriform plate that we have learned. So anterior skull base, these are the two foramina we need to know. After the lesser wing of sphenoid, we have optic canal, which is lying medially. We have this fissure, which is the superior orbital fissure. And then you remember Ross. But out of Ross, what you need to remember on a CT section, which is the one foramina which is not going to be in the same line as all of these schematics, rotundum, right? So rotundum will not be seen in the same plane. It will be oval and spinosum that will be visualized. So that is one learning point that you have to take away on a CT image. Oval is oval, behind that spinosum, rotundum will be more inferior. And what will be more inferior to the rotundum? So rotundum is upper. नीचे क्या था? नीचे से remember Vidian, right? So within the pterygoid, upper in a coronal projection will be rotundum. Inferior to it will be the Vidian canal within the pterygoid, which both open into the pterygopalatine fossa, right? And then going further near the petrous apex, you have the foramen lacerum here, just near the fissure. You have the internal auditory meatus, you have the jugular foramen and carotid canal anterior to it. Finally, within the beak of the occipital condyle, this is the hypoglossal canal, and finally, this is the foramen magnum. All right, so this is what we had planned for you. So, sir, any closing words that you want to tell the students? Sir, you are not audible.
Sorry.
Yeah.
So I hope everything is clear. The anatomy and the radiological part of it, Dr. Zainab has very well explained everything. And like we discuss this all the times in the lectures, the foramen and the structures passing through it. So this will be a revision for you. Any doubts you have, you can ask. Yeah, if you want to add anything, Dr. Zainab.
That's it, sir. That's it, sir. So this is again very, very important. And just to take it one notch higher, they can show you any of these CT images. So it'll be a good idea to just go through these CT sections also, as well as actual skull images. So these are the kind of questions which usually come, and they will ask you the content. So straightforward questions. So just revise this one more time, and you should be set to answer at least one question in your exam. So thank you so much, sir, and I learned a lot from you. So thank you for
Thank you.
sharing the screen. And all right, sir. So that's it, I think.
Any doubts anyone has? Students, any doubts? So we will plan many more lectures in future. This was just the beginning. So
Yes, for sure. So thank you so much, and do share your feedback and any other topics that you want to learn from us in an integrated manner. We'll come up with those. So thank you so much, and good evening to all of you.
thank you to all of you.
Thank you, sir.
Thank you, Dr. Sandeep. Thank you. Chalo, bye bye. Thank you.
Bye, sir.